Immunize Canada is partnering with CANVax to produce a series of webinar shorts, which are quick, pre-recorded videos addressing specific topics related to the impact of COVID-19 on immunizations. For this webinar short, we hear from Adrienne, health promoter at Huron Perth Public Health. Adrienne will present on the topic of community-based immunization clinics for grade 7 during the COVID-19 pandemic. Huron Perth Public Health is a rural health unit in Southwest Ontario. Their vaccine-preventable disease team was highly motivated to deliver the grade 7 vaccines during the pandemic. So they took on the extra work to coordinate this successful program. Let's hear more from Adrienne.
Community-based immunization clinics for grade 7 students during the COVID-19 pandemic. Huron and Perth Health units vaccinate grade 7 students annually as per Ontario publicly funded schedule. The standard approach that Huron and Perth Health units have traditionally taken to provide the grade 7 vaccines to students is in the school setting. As schools closed in March 2020 due to the COVID-19 pandemic, these students were outstanding for Minectra or their second dose of Gardasil or hepatitis B vaccines. The second dose of the HPV and Hep B vaccines is required for full protection, and they must be administered within 6 to 12-month timeframe. In an effort to reach all outstanding students to provide these vaccines in the required timeframe, community clinics were held in August 2020 and December of 2020 throughout the Huron and Perth region. This is the first time that Huron and Perth Health units would hold community clinics for this population. It was also the first time that Huron and Perth worked together on a project of this nature as one merged health unit. Huron Perth Public Health. The community clinics in August 2020 for the 2019 to 2020 grade 7 cohort was to catch students up on their second doses and was successful in reaching approximately 80% of students. As the clinic model proved to be successful and even preferred by parents, students, and clinic staff, more community clinics were held in December of 2020 for the 2020-2021 grade 7 cohort to reach those students with their first doses and to reach those from the previous year's cohort to complete the vaccination series. A public health update was sent out to doctors to thank them for immunizing those students who may have missed attending a community clinic and to alert them of the next round of community clinics that Huron Perth Public Health had planned. Clinic details. In terms of location, Huron Perth Public Health reached out to municipal partners requesting donation of space for clinics and had an excellent response from partners. 9 locations were secured throughout Huron and Perth to ensure equitable access for residents. For booking appointments, in the August 2020 clinics, parents of the students of the targeted cohorts received a letter in the mail regarding the need for second doses and were asked to call the health unit to make an appointment. For the second round of clinics held in December 2020, an online booking system was used. The system that HPPH was able to obtain within the budget and timelines came with some challenges, so HPPH is continuing to explore the most efficient booking system. The next 2 slides will show the promotional materials we used and how they were disseminated. This promotional poster was used in social media posts and was also emailed to grade 7 parents through school boards. Promotion of these clinics on Huron Perth Public Health social media channels and website seemed to provide good exposure and was timely and effective. Clinics were held in August to catch up second doses for grade 7 students from the 2019 to 2020 school cohort. More community clinics were held in December of 2020 to provide first doses to the 2020-2021 grade 7 cohort and to catch up on the small number of students who were still outstanding for their second doses from the 2019-2020 cohort. This flyer was sent to all schools in Huron and Perth and put in the grade 7 and 8 student backpacks. The flyer was also posted on social media and information on the HPPH website. This flow chart shows the process that was followed at clinics to ensure adherence to IPAC and social distancing. So you can see here, the client will arrive at the clinic and do the screening at the door with the COVID-19 questions. Once the screener ensures that the student and parent are wearing their mask correctly or provides a mask if necessary, They are asked to sanitize their hands, then check in with the administrative assistant to receive their consent form and complete the consent process. Then the administrative assistant would direct the student and parent through the entrance door to wait in line for their immunization, of course maintaining a 6-foot distance between individuals in the line. Next, the nurse would call the student in line to their station, verify the student, ask immunization-specific screening questions, draw up the vaccine, and administer the vaccine to the student. The student would be asked then to wait 15 minutes in the designated waiting area. The nurse would sanitize the workstation after the student leaves from their vaccination. The student would leave the building through the designated exit door, and upon leaving, an IPAC lead would sanitize the designated waiting area where that student was. Upon leaving, the student would be asked to discard their face mask in the garbage can. Successes of the community clinic model. The community clinic model proved the strength of partnerships that Huron Perth Public Health has with its municipalities and community centers, who generously provided space to the health unit at no cost to hold the clinics. Huron Perth Public Health staff rallied and came together to ensure clinics were carried out promptly and with precautionary COVID-19 measures strictly in place. These community clinics also allowed for a majority of the grade 7 students who were outstanding for Minectra or their second doses of HPV or Hep B to be immunized. Takeaway learnings from the community clinic model. As previously mentioned, communication was sent via email through school boards to parents of the applicable students regarding the vaccination clinics. But because timelines were tight between communication going out and clinic dates, we also allotted staff to make phone calls to parents to book appointments. This proved to be an effective way to reach parents and get appointments booked, but it was time-consuming for staff. It was also agreed upon by staff that telephone was effective for booking appointments, but it was not ideal from a staff capacity perspective. Some booking systems are better than others, but overall, online booking was the most effective way to book appointments for both parents and for HPPH staff. Staff who worked at the clinics also noted that parents prefer to be with their children when being vaccinated, as did many of the students. Additionally, if a student felt unwell or faint after their vaccination, having parents on site was a great help to HPPH staff in terms of staff capacity. Staff did not have to discontinue vaccinating other students to care for those who felt faint or unwell, as the parents could take care of their child. Coverage offering first doses at community clinics, yielding lower numbers than the traditional school model. However, we felt it was better than not offering anything at all. Final thoughts. HPP would consider offering community clinics to school students again in the future based on availability to access schools this fall. HPP has recently secured an online booking system built into our website to improve appointment scheduling. And as the fourth wave of COVID-19 is upon us, HPP will continue to look at opportunities for delivery of these vaccines to this population. Thank you.